So if we look at the 2026-27 budget, one of the things that has been done here is a $126 million allocation for Medicare-funded 3-year-old health assessments and an expansion of the Comprehensive Health Assessment Program as part of the Thriving Kids program. So my first question is, will the 3-year health assessment be used to determine eligibility for the Thriving Kids program?
So, Senator, the answer is no, but my more general procedural point, I'm in the hands of the chair here, is I think if we're going to the question of eligibility into the disability system, then that would be estimates on Friday.
Yes, well, that's a very interesting point, Secretary, because we're not quite sure where Thriving Kids sits. But my questions are predominantly about the 3-year health assessment program.
I'm happy to take questions on the 3-year health assessment, but I think if we get to the question, is it being used as an eligibility funnel into Thriving Kids or any other program of disability, the answer is no.
That's great. You've given that answer. That's fabulous. Okay, thank you. Who will be able to deliver these health assessments?
So, Senator, these health assessments will be performed by GPs, but the GPs can be supported by their practice nurses as part of that health assessment. Okay.
And how will the details of the 3-year-old health assessment then be developed?
So we've had, which my colleague can talk to a bit more, a expert group come together to have a look at the literature for what we need to do for a 3-year-old health check, and that has been developed.
Louise Riley, Assistant Secretary, MBS Policy and Reviews Branch. Thanks, Senator. We had established an implementation liaison group to work up the requirements for the 3-year-old health check. That included someone from the AMA, someone from the RACGP. I'd have to check who else. I have a feeling it was ACRM, practice nurses, but I can provide that on notice if you wish.
If you could provide on notice, that would be great. So that was a group that you have got together.
Yes.
So that group is now to undertake that work, or that work has been complete?
It's largely been completed, Senator. So they've developed up, an item descriptor, what the requirements of the item are. It's important to note that the 3-year-old health check will use existing time-tiered health assessment items. So there already exists in the MBS a set of health assessment items that go from a short health assessment to a long one. And so 3-year-olds will become another eligible group of patients who can access those items.
Right, and that's for we're talking here about the 3-year-old health assessment.
Yes.
They've been doing work on that.
Yes.
That piece. So have they also been doing work on the comprehensive health assessment program?
So the CHAP tool, Senator?
Yeah, that was flagged in the. It was flagged in the budget on page 126.
So, Senator, that's been largely led by colleagues in Primary Healthcare Division.
Okay, have we got folks from Primary Healthcare Division who can come and talk to us about that?
Senator, that comprehensive health assessment is actually sitting with our disability colleagues who are not here until Friday.
Okay, so the disability colleagues, right.
Yeah, so we moved that, as Mr Connolly talked about, as part of our broader Thriving Kids work, which is sitting in the disability team.
So it sits with the team, but still within the department,
yes.
The team within the department, and they will appear on, they're scheduled to appear on Friday?
That's correct.
Okay, so staying then with the 3-year-old health assessment, which you can answer questions about now. Okay, thank you. These are the kind of confusions that we get into when these programs are devolved and shifted. So you've spoke to us about how the details of the 3-year-old health assessment will be developed. You've said there's been a team of people brought together representing different organisations. Was there an organisation involved in that consultation that was there from a disability health perspective?
So, Senator, there wasn't specifically recognising that for the 3-year-old health check, it's available to every 3-year-old in Australia.
Yeah.
So, Senator, it's probably important to note that the recommendation to establish the 3-year-old health check came out of the Minister's Expert Advisory Committee on Thriving Kids, which included disability advocates and advisors as well.
Yeah. So that was a recommendation that came out of that committee.
Yes.
But that sits here in this division of the Health Department, even though it came out of the Thriving Kids recommendation?
That's correct.
Okay. But there wasn't a disability, even though it was a Thriving Kids recommendation, there wasn't a specific disability health stakeholder involved on that consultation group.
No, but Senator, there was the GP, like I can remember from memory, the GPs that did it were like the special interest childhood people, for example, from the RACGP.
Okay. In fact, I think, Senator, and Ms Wiley might correct me, but the GP that was involved in the development of the 3-year-old health check was involved in the Expert Advisory Committee. Yes. With the disability advocates, the early childhood advocates and experts as well.
So they were involved in that broader work.
So there's cross-pollinisation from the Expert Advisory Committee.
But
there wasn't, just to be clear though, that there wasn't disabled people's representative organisations or disability-specific health experts involved in that consultation for the 3-year assessment.
No, we did have a paediatrician from, again, Senator, I'd have to check, I think she was from Monash Hospital, who has a special interest in children. She participated on the ILG. And, sorry, the team's just sent me through, so I can tell you we had representatives from the AMA, the RACGP, Australian College of Rural and Remote Medicine, Practice Nurses Association, the National Aboriginal and Torres Strait Islander health workers, and the paediatrician I was just referring to.
Okay. Now, the Royal College of General Practitioners were calling for annual developmental checks in the run-up to the budget across the first 2,000 days of a child's life. Was there consideration by the government of a similar approach to this, so that the child's progress can be tracked across that period of time, rather than just basically having a snapshot at a singular point in time?
So, Senator, I think all the work that we've done in this space was focused at children from 0 right through to 8. In the context of primary care, I guess our discussions have been focused around leveraging their existing time-tiered items, using every opportunity when they're seeing a child to work through any developmental concerns. Government is also investing in a national children's health record as well, that GPs and other professionals will be able to use to update and record progress notes. But the 3-year-old health check was a specific recommendation to make sure that we had a safety net for all children by the time they turn 3. If they weren't seeing health professionals or child maternal services earlier.
I understand that. The problem, though, is you're getting a snapshot rather than the kind of more comprehensive picture that was recommended by the experts. So,
Senator, as part of the work that we're doing on the Children's Health Record, we are working with the College of GPs, disability groups, states and territories to have a look at all of the key milestones for children from 0 right through to 8, and we'll be making sure that we have mechanisms to capture all of those key developmental milestones. But government's made a specific decision to fund the 3-year-old health check, as I said, as a really important safety net for all children.
But that certainly doesn't prevent the child having consultations with the GP on a more regular basis. They would be funded through Medicare under normal time-tiered items.
No, I very much understand that. When Minister Dutt Butler initially announced Thriving Kids, and I'm mentioning it because we're talking about a recommendation of the working group around Thriving Kids, he said that the government would look at new Medicare items for allied health, including occupational therapy, speech pathology, psychology, psychosocial therapy, as part of the broader Thriving Kids program. We haven't seen any of these Medicare items Yeah, are they on their way?
So, Senator, the government looked at a range of options for how we could best use the Medicare system and allied health professionals, but government has focused on working with states and territories to establish services for children as part of the Thriving Kids program, and that's where most of the effort and investment is going to be focused.
No, I understand that. I'm just referring back to the Minister's press club address, where there was a number of other areas.
We canvassed a whole range of options through the expert advisory committee, Senator. Including
and you canvassed them, and then this is the result. The result is this
is where government has made decisions.
So no speech pathology, no other Medicare items.
So those services are available in Medicare today and will be available to children that need them. But also, Senator, and it's probably better discussed on Friday with my disability colleagues, a lot of their focus will be developing and commissioning services through states and territories to support all of those types of supports.
So hang on, I'm a bit confused. So the Minister was untruthful at the press club about...
No, he wasn't untruthful. At the press club, which now I'm just trying to remember the exact date, was probably August last year, the Minister put out what he thought at the time was his hypothesis as to what the system would evolve. There was subsequently both the Overclade Committee but also the negotiation with the states and territories. In the negotiations with the states and territories, there was a consideration of the value of these allied health services and what the relative priority of those at this point was compared with what would be commissioned through what is known as the Thriving Kids program. So at the moment, the government is still considering whether it would have such items in the future, but the clear feedback, for example, from states and territories was that the priority was to set up the Thriving Kids program, which is commissioned. That itself may involve some of these allied health activities, but it also may involve other support such as parenting groups, group activities, etc. But perhaps we could... So the Minister was putting out his ideas at the time. There was an engagement with states and territories, there's the Overclade Committee, and at this stage the 3-year-old health check is the thing the government is proceeding with.
Yeah, but again, the Thriving Kids is for kids up to like 8 or 9, and we still have this quite significant gap. Like, what are people over the age of 8 or 9 meant to do in terms of speech pathology, for example?
So, Senator, if I can go to that, you'll recall that we recently added severe speech and language disorders to a group of Medicare items that enable a GP to refer a child with severe speech and language disorders to a speech pathologist, and they can receive up to 8 assessment services and up to 20 treatment services as well.
It's wild. I think this is why there is such high levels of confusion and distrust in the community in relation to what the government is doing in this space, because, to be quite frank, when the Health Minister, who is also the Disability Minister, who is also the NDIA Minister, steps up at the National Press Club and talks about what the program will deliver, there is an assumption that they're talking about what the government will then deliver, not that he's riffing on his broader vibes of what should be included.
If you read the speech...
Oh, I read it.
Yeah,
and,
sure.
And watched it.
As I recall it...
Many times.
mean, Minister Butler also outlined the need to consult further and work with the states and territories. We have been very clear about that. Now, you just asked what's happening about, speech therapy for a cohort, and you got the answer of what the government has done already. So you can't just brush over that because it was an inconvenient anscer.
I'm familiar with that program.
What have you done? Well,
I'm familiar with that program, though, and I believe it's about 20 sessions per year. Is that correct?
So, Senator, it's 8 assessment sessions, up to 8, and up to 20 per lifetime, recognising
across the lifetime.
Recognising, Senator, that those people can continue to access speech therapy through a chronic condition management plan, which renews every year.
20 across somebody's lifetime, you know?
And in addition, if you listen to the evidence, can access further... Well, no, but you're just... Because it's not a convenient answer to you, you're ignoring the evidence.
I'm trying to give folks the benefit of the doubt, but okay. It is an area of policy I'm very familiar with. 20 sessions across a lifetime is nowhere near enough. The additions that you can then access through the chronic disease management plan also leaves a significant portion of those who require speech pathology without access to the intensity of support that is needed either through life or at particular stages of the development of speech and communication capability, particularly those who are neurodivergent or autistic. Everybody that knows anything about this area of policy kind of knows that, so I didn't really pick us up on it because we should have better things to do. But you all know that's not sufficient, and I think I'll just leave that there.
Okay. Thank you, Senator Steele-John.
Authorised by J. Steele-John, Australian Greens, Canberra.